DSM-3R, because there isn't a DSM-4 version, and doing a retrospective diagnosis with our group to ensure that they would have met the criteria for a diagnosis of schizophrenia. But that was one thing that we did to overcome some of the problems. The other thing that you find in the literature is this concept of complete recovery versus social recovery, and certainly Richard Warner, he talks about complete recovery versus social recovery, with complete recovery being the person having no symptoms at all and then returning to a pre-illness level of functioning, as opposed to a social recovery where people actually still have symptoms of the illness but are living quite a full life with working, and they have good social interactions, etc. So there are other concepts that you come across in the literature on recovery from schizophrenia, this notion of complete recovery versus social recovery, and you'll see the implications that those sorts of concepts have as we go through. Okay, recovery from schizophrenia. What I'll go through is the analysis of the work done by Richard Warner in 1994. He actually reviewed 85 studies on recovery from schizophrenia that had been conducted this century. And from that work he concluded that the disorder is either a remitting disorder or a catastrophic one. He also identified a number of methodological issues with the studies that make looking at recovery from schizophrenia difficult. Some of the problems with the studies have been, how do you compare studies that have inconsistent diagnostic criteria? You know, if the diagnostic criteria isn't clear, then how can you say that this person has, how can you compare studies? Which is, as you all know in the research area, is what we're very good at doing, or need to have to make us feel comfortable with the results that we come up with. There's also problems with comparing different genders, different ages and different status, like whether you had someone who was recovered from acute onset that only had one episode, as opposed to looking at someone who had recovered who would have been considered having a chronic course of the disorder. So there was problems with those follow-up studies, and also the different follow-up intervals, like did you follow up someone 2 years after they had left hospital, did you follow them up 5 years after they had left hospital, how did you determine when did you follow someone up? And so comparing studies and looking at trying to make sense of the literature become difficult. What Warner says though is that given that the large number of studies that he was looking at, that really those factors should have equaled one another out. So measures of recovery, certainly the rigour of definition is important. So when we talk about recovery from schizophrenia, what are we talking about? Are we talking about recovery from the symptoms of the illness? Are we talking about recovery in social functioning, that is work, caring for the basic needs, abnormal behaviour, that the people aren't involved in crime, that they have a number of friends, that they have good sexual relationships? And it's very hard to standardise those measures. And so if you want to determine whether someone's recovered in terms of social functioning, how do you do that? And another way of measuring recovery is the person in hospital or are they out of hospital? And of course they're unreliable measures. So measures of recovery is also a difficult area. How we chose to look at that was, we decided that if we were going to talk about recovery from schizophrenia and be truly honest to the notion of a consumer definition, that we would allow that to be determined by the people who entered our project. So how people got into our project was, we advertised, if you believe that you are in recovery from schizophrenia or recovered, and you would like to help us understand how you did that, would you please come and talk to us? So we invited people and let them make that definition. So we didn't have a definition of recovery from schizophrenia, and certainly that definition of recovery is one that we have asked the participants about. We have asked them to tell us what they consider recovery to be, just to see if there's what discrepancy there is between what the literature says and what consumers say, because clearly what we think about as professionals is often quite different to what consumers think about. So we didn't impose a definition of recovery, and as you can see there's lots of problems with using specific measures of recovery or talking about it in specific ways. So Warner's studies, this is what a basic outline of the conclusions that he had drawn. He said that complete recovery was a loss of psychotic symptoms and a return to a pre-illness level of functioning, as I've already stated, and a social recovery was one that had an economic and residential independence and low social disruption. What he found also was that the recovery rate is not significantly better now than what it was at the beginning of the century. Now that has major implications if we think about what we have been doing in mental health care this century. The recovery rate, when you look at these studies, isn't any better now than what it was before. He also found that antipsychotic drugs had very little effect on outcome. And yeah, I'm aware that there's a few people in the audience who share that view. Particularly in relation to the major tranquilizers, they had very limited effect on wards where there was attention paid to the therapeutic environment. So really the only places where antipsychotic medication was effective was in those treatment settings that were inadequate. So it was really a form of control, if you think about it in those terms, that the outcome has not been impacted on by antipsychotic medication. In fact, deinstitutionalisation was found from those studies to be taking place well before the advent of the antipsychotic drugs in the 50s. What he found from looking at those studies and using those definitions of complete recovery versus social recovery was that complete recovery remains about 20 to 25% and social recovery remains about 40 to 45%. So you can see that's